Well, the government has now announced guidelines for home isolation of mild cases of coronavirus. Yes, you heard me right. Those who have mild cases or very mild cases of the coronavirus are now being told, no, you can stay at home. Now, this is different from what the rules earlier were, where you needed to report to a hospital or to a facility where you were quarantined and where you were treated. But now, there's a difference, and the question that we're asking is why? Now, what are the circumstances in which you can stay at home? Well, according to the government, this is the Health Ministry, the patient must be clinically assigned as a very mild case by a medical officer. The patient must have a requisite facility at their residence for self-isolation. A caregiver should be available to provide care on a 24/7 basis. The patient must be in touch with a district surveillance officer. Hospital patients will have to sign an undertaking. Well, joining us now to look at this, Dr. Naresh Trehan, Chairman and Managing Director of Medanta at the Medicity, and Dr. Ashok Seth, Chairman of the Fortis Escorts Heart Institute. I'd like to thank both of you very much for joining us. Dr. Trehan, let me come to you first. Why this change in strategy, sir, for even the mildest of cases?
So, now that we are getting ready to unlock, there may be many cases, and our experience tells us that 80% of the cases are mild or asymptomatic. Now, to put them in hospitals, and if they come by large numbers, then they occupy hospital beds, which are needed for treating sick patients. Also, worldwide, there has been an experience already, so that we can, with confidence, say that people who have fit into the prescribed format, like you said earlier, very mild symptoms or no symptoms, but tested positive, people who have the facilities at home to isolate in one room, and that they can be isolated in that till the period that they become negative. There are 2 tests that are negative, contiguous tests. Then you know that they can be released. So, first of all, the rules are pretty strict and well prescribed. So you have to register on Arogya Setu. You have to have a medical officer who is actually connected to you, so that you can actually report regularly your condition on a daily basis. And you also understand that the caregiver has to take certain precautions, and everything that is surrounded around you, or your food utensils and all that, there is a prescribed way of cleaning them, washing them, desanitizing them. So the key here is that the patient will always wear a 3-layer mask if anybody is around, and anybody who comes in touch with them will wear a 3-layer mask and gloves. And also that the symptoms, if they develop, like shortness of breath or blueness or pain in the body, severe pain, persistent pain in the chest, then they must report to the medical officer.
Sure. And
may have to be moved to the hospital.
Okay.
So this is a good strategy. It's a very good strategy. It is safe in the sense. Also, they have to be put on hydroxychloroquine.
Right.
All the people who are in the house.
Right.
So I think that this.
You think, right. I just want to go across,
safety.
Dr. Trehan, I just want to go across to Dr. Seth for a moment as well. Dr. Seth, when does an individual or their caregiver realize that the patient who's unwell needs to go to a hospital?
So these are well defined now, and we must remember that this is a great idea, because at the moment, as we open the lockdown, it spares up the beds for perhaps more patients which may come in. It's been practiced, by the way, in United States and Europe, because they've been their healthcare systems have been overloaded and inundated, and even mild cases are treated at home. Now, the Ministry of Health has defined this very clearly. Asymptomatic or very mild. It's actually separated out the mild, moderate, and severe to remain. Very mild means those patients who either have mild fever, controllable fever, mild body aches, mild cough, and therefore they're really not in any distress. Now, when they change their symptoms, it's very important to understand that they might develop very high fever with chills and rigor, which creates concern and perhaps not being able to manage at home. They may get dehydrated, they may get delirious. But the government has clearly defined that if you feel chest pain, if you feel breathlessness, if there is a deterioration of confusion, if blueness of mouth and toes develops, breathing difficulty develops, all those are clear features that actually need to be informed. And by the way, there's a daily, twice-a-day connection, in fact 24/7 connection by the caregiver to the local health officer. So it is not an unsupervised treatment in a way, it's constantly supervised treatment.
Okay.
And all that is happening is that in our COVID care centers, as they were called, where there are nearly 800 patients in Delhi, there was a 4 times a day round, checking of temperature and supervision only. And that is what is being transferred to home so that actually patients can look after themselves. But on the other hand, it's not easy. I can also tell you that if you actually understand what has been asked of the patient, it's clearly replicating the hospital to home, and you have to follow those meticulous restrictions, guidelines extremely carefully.
Right, Dr. Seth, just one sec, because I'm running out of time. I just wanted to
say one more thing.
Yeah.
There's a few people who would put into it. It's usually the upper class and educated class, because all those have defined that you have to have a separate room, separate bathroom, a quarantine facility for your family. So it is practically the middle and the low middle class is not going to be able to adjust to it. But still, it's a good idea to move those who can afford it and those who can practice it, to ship them out of the hospitals to their homes.
Dr. Trehan, one final question to you. A family unit would have many individuals, and obviously somebody who develops mild symptoms, tests positive, they would need to be very careful, their caregiver would need to be very careful. But isn't there a huge risk over here that a person with very mild symptoms can actually pass on this infection, which is very, very infectious and aggressive, to somebody else who then ends up developing very serious issues, because they may be older, they may have comorbid conditions, whatever it is. So isn't there a risk involved for a family unit of a person who might by themselves have very mild symptoms?
So, it is locational. Now, you're right that if there are older people in the family, there are people with comorbidities in the family, you have to think twice about doing it. And what the efficacy of the isolation is going to be in a house has to be determined. Even a medical officer can advise you if it is possible, is it good or not. So I think that this is a good move, but the public or the people who are going to do it, the caregiver and the patient, must be fully educated on the norms of what they have to follow. Now, if you look at the guidelines given out, they're fairly well detailed, and when to move to the hospital, when to get in touch with the medical officer. Now, I can also tell you today that there is a technology which we are hoping to get in the next week or 10 days, where you can put a patch on the patient when they are at home, and it actually transmits by Bluetooth the temperature, the coughing incidence, the breathing speed, and the SpO2 or the oxygen concentration. If we can do that from home, it doubly secures the fact that the patient is safe at home. Now, also the caregiver should be very careful about treating, and the family has to be far away. Okay. So if you have that facilities or not, that depends on the individual. And if you do, then you can be treated at home and be isolated with all the rules.
Okay, I just wanted to bring in another element in this program, where the US CDC, the Center for Disease Control, has introduced or mentioned to people around the world a number of new symptoms associated with COVID-19. The World Health Organization has actually spoken about this on their website as well. Chills, repeated shaking with chills, muscle pain, headache, sore throat, a sudden loss of taste or smell. Dr. Seth, would you like to comment on this as we progress through the course of this illness in India? What are some of these new symptoms that you're seeing? Are you hearing or coming across individuals, for example, with a sudden loss of taste?
Yes, Vishnu, and also I would reflect on the one more point on the last question, is that it also involves quarantine of relatives at home. So that's one of the criteria for actually home treatment of mild and asymptomatic COVID patients, quarantine of relatives at home.
Yeah.
Now, moving on to your question, actually most of these, especially that loss of taste and smell, have been defined before. We just, as more disease processes progress, these symptoms become important, because loss of smell and taste was first noticed by the respiratory physicians, and actually preempts the active symptoms of fever. And sometimes this happens a couple of days prior to developing of fever, chills and rigor, and severe symptoms. So in fact, it's something one needs to notice. It is something it's been emphasized because it's described much more frequently as time has gone on. And it's something we have to start noticing in our patients even prior. It happens even in asymptomatic patients rather than the ones which are totally symptomatic. So it preempts everything by a couple of days.
Okay. Dr. Trehan, what are some of the other conditions which you are hearing about or you're perhaps seeing yourself associated with COVID-19? For example, there's been a body of work now, limited, but they talk about strokes also in some individuals taking place as a result of this. So we know the impact on some organs of the body. What are some of the other parts of the body which could be affected or which are being affected?
So we know one thing, that the primary target of this virus is the lungs, because it spreads through the respiratory system. Eventually it crosses over and spreads all over the body, but the vulnerable organs are the kidneys, the heart, and could be the brain. So that's why we said in the symptoms that you described, you could be getting chest pain, because especially with people who have pre-existing cardiac conditions, you have to be extremely careful. We are seeing a lot of these patients coming in with chest pain, and the virus actually eats away wherever the tissue may be. So it starves the tissue of oxygen, and that's how the damage starts to happen. We have seen many patients who are being reported with renal failure. So, and that's why if you can have delirium, you could have chest pain, and you could have renal failure. But so all these three things have been noticed quite frequently. Now, one of the observations that came out in Indian patients was a lot of them will first start with gastrointestinal systems being affected, means they start developing a diarrhea. And this diarrhea may precede the illness by 1 or 2 days before you get the other symptoms. So it does behave in a peculiar way. Like you said, the CDC has just said about loss of taste and smell. Yes, these have been reported, but some of the patients have reported pain in the throat of the level which they've never experienced before, because they've had sore throats, but this one. So these are not consistent in everybody. So it does not mean that if you don't have severe throat pain, you don't have it. But at the same time, there is H1N1, which is swine flu, is also prevalent in many of these patients. When they are tested, we think they may have COVID, but they turn out to have swine flu or some other regular flu. So one thing that is very clear today, that as testing facilities are being expanded, and we all know that the control of this pandemic will depend on how much testing we do and how we discover it before it actually spreads to the community from people who may have gotten infected. So this is the time of caution, because we are looking at the eve of unlocking in some form or the other.
Okay.
And when this happens, our antennas have to go higher and very receptive of who could be or who could not be. And basically this whole facility of isolating them at their home or quarantining people at home is a very good idea, because no amount of hospital beds would have been able to take care of all these patients.
Okay, Dr. Seth, Dr. Seth, one last question to you as I wrap up this program. Is it true that a lot of individuals, when they do end up in hospital with COVID-19 serious symptoms, are coming to you desperately short of breath, even though perhaps a few hours prior to that or a day prior to that, the symptoms of breathlessness may not have been that acute? Is there a sudden and strong onset of breathlessness is my question.
Absolutely. I think that is the crux of the matter. The deterioration is more rapid. The deterioration has to be noticed. And the first signs of breathlessness may portend much serious infection of the lungs with pneumonia. And that also can rapidly deteriorate into ventilation. That is the reason why the 24/7 advice of handling these symptoms at home. And in fact, often they are going to be advised to measure the oxygen saturations and heart rate through a pulse oximeter. Because one of the first symptoms is You may not even feel breathlessness, but your oxygen saturation start going down. And that's one of the first points to notice. These are the methods that have to be taught to the patient's relative.
Okay.
The duration is fast, can be rapid, needs transportation to the hospital, needs observation. But actually, 15% of the patients would stabilize at that point of just breathlessness with some pneumonia, which would still recover. It's those 5% that we worry about. The ones who are elderly, the ones who've got other comorbidities, the ones with diabetes, hypertension, and heart disease, who can rapidly deteriorate into those requiring ventilation, and that actually portends the worst outcomes. But there's one more point. Nearly 10 and 15% of them do develop heart problems as well. And this is a whole new arena that we've been discussing and having webcast internationally amongst all of us cardiologists as to how to manage the cardiac manifestations of COVID disease. In fact, COVID is not just a lung disease now that we're realizing that COVID is also a heart disease.
All right.
And we've got to be careful of that as well.
It's frightening in as much as it's fascinating to know the science of this. How COVID is a heart ailment now as well is something that Dr. Seth mentions. Dr. Trehan, Dr. Seth, two of India's finest cardiologists, thank you very much for joining us.